Today is the very first graduation of our first cohort for the ATI Incubation Academy. It's amazing what's happening here. As you know, the Board of Supervisors have decided to really push the Care First Jails Last model in our county. And we've created the job where I sit, which is alternatives to incarceration. But you really can't have alternatives to incarceration without the alternative piece. So one of the things that we've really worked on is creating more access to services and housing. And this is our first cohort of new folks coming in to be part of the county family to provide those alternatives. For the past 10 weeks, these 20 organizations have learned everything from soup to nuts. So they've learned everything from trauma-informed care, how to handle their financials, all the way to how do you exercise and have a county contract and everything in between. So it's really about how do you serve the community and how do you run a business.
We serve about 1,000 people every year across different areas of the program. We offer, like I said, a broad range of activities from HIV to housing support, including rental assistance. And so we have this intersection approach that really allows us to really reach people on a more intimate basis, and we're really proud of our team. MOD is an acronym for Arming Minorities Against Addiction and Disease, and it is also Swahili for support. I founded the Ahmad Institute some years ago because I was looking for an organization that met my needs when I was released from incarceration. And so I didn't find the support that I needed in the community. Once I got myself stable and into a good position, I made a purposeful decision to create the Ahmad Institute to address all of the issues that I thought were important to community. One of the first projects that I named within the Ahmad Institute is our Reclaiming Innocence project, which provides housing support, rental assistance, and mental health therapy to individuals who are being released from California State Prison. The Ahmad Institute, I always say, we are this intersectional health and wellness social work organization that really seeks to provide peer-based work. Much of our work is centers around social work and basic principles. Some people would say that we are a housing support provider. Some people would say that we're an HIV prevention and support provider. Some people would say that we're a mental health provider. Some people would say that we're a youth engagement organization, and I say that we are absolutely all of those things. We prioritize Black LGBTQ people and who are disproportionately impacted, and we do our work in a way that is unapologetic from that lens. I think housing is mental health treatment. I also think it's HIV prevention. I think it all goes together. And then especially for individuals who are formerly incarcerated, I think being able to be a resource for those who are especially challenged with getting their lives back on track, it's important to have a holistic approach to the way in which we engaged in it. So that's our model at the Ahmad Institute.
You cannot have alternatives to incarceration without the alternatives. And this is the beginning of one of the pieces to help it build those alternatives.
Incubation Academy has really helped prepare us to think about some of the administrative pieces that need to get further refined to help us to really be a service provider that is able to kind of work within the nuances of county contracting that can be very complicated. And I think that's been the biggest portion of what's been important to me. So MOD had come along before the Incubation Academy, but I absolutely believe that everything that we talked about within our sessions with my fellow cohorts have benefited us for our next phase of growth. The advice I would have for someone wanting to join this Incubation Academy is to take it seriously. Submit your application. If selected, make sure you attend every single cohort because there's something to learn. Network with individuals. Reach out to your cohort members to really follow up, to engage. I think you will be stronger for it, and I think you and your organization and the people you serve will reap benefits from it. What I'm hoping to do is to grow our peer-based network as an organization to have a full, whole person approach to the way in which we address the needs of community.